So I'm Diane Lambie. I work within the Scottish Government in the Tackling Food Insecurity team. I'm just going to give a short presentation today. Excuse me. So the challenge that we're facing just now is the insecure incomes drive household food insecurity. People have to compromise on food, other essentials, and the Scottish Health Survey has confirmed that it impacts around 8% of households. We know that a referral to food bank is often the simplest and quickest route to supporting someone experiencing hardship. Opportunities to strengthen income, prevent future hardship are often missed. Food parcels rarely able to meet dietary, social and cultural needs and preferences. And again, we know that the loss of the key income supports, furlough, universal credit, uplift, rising cost of living, increase in national insurance contributions, they're going to increase financial hardship. So the Scottish Government promotes a human rights approach with the powers that we have. Prevention, we look at how can we prevent and strengthen incomes from fair work, social security and reduced cost of living. We need to make sure everyone has enough income to afford food that meets their needs and preferences. We need to explore minimum income guarantee, universal basic services, support rollout of cash first referral leaflets, which have proved extremely successful and helpful. Ensure dignified food access through partnership workings. To respond when emergencies and crises arise, obviously joined up local responses to hardship that seek to make food banks the last port of call, promote emergency financial assistance, for example, cash first and money advice. How do we do this? We've got the Scottish Welfare Fund. This should be the first port of call alongside other discretionary supports before accessing food. DHPs help support as well. We're mindful, however, that cash first might not always be the most appropriate approach. Some people unfortunately may suffer from domestic violence. If they're in debt and cash is paid into their account, it might be consumed by an overdraft. So we need to be mindful of all the options. For Scottish Welfare Fund, there's £41 million this year been allocated. Money advice, we provide funding to partners and agencies such as Citizens Advice Bureau and agencies and providers that support frontline advisors with complex housing, benefits, money issues. And we also have the Money Talk team. The flexible funding from 2021 helped steer the funding for winter 21 funding. We tailored the support around the flexibility that was afforded in the flexible funding from last winter. Engagement sessions with the councils for that flexible funding clearly highlighted how vital it was that they had flexibility to manage the fund in an appropriate way for their own local needs. And we took that into account when developing the guidance for this. We also need to look about how we can support learning and local partnerships with the emphasis on cash first and getting money out first. Food bank, again, should be the last port of call. Many examples of this were highlighted through our engagement sessions. Cash first payments were made to families in receipt of free school meals throughout the pandemic. Additional pandemic payments were issued to families. Local authorities carried out data matching exercises to identify people that were claiming a range of benefits that could possibly not be aware of the range of support that was available. And they were able to support these people, which resulted in a high uptake of applications for benefits that they were unaware of through income maximisation interviews. Again, we discovered from conversations that a number of local authorities set up their own bespoke hardship funds. And we're going to hear a wee bit more about this further on in the presentation. We will be evaluating, monitor and evaluating the funding that has been issued through the Winter Support Fund, just like we did last year. Always keen to look at what's going on, any lessons that I've learned, and the prime lesson that we learned last year was, again, the flexibility of the funds. The consultation on the national plan was issued on the 20th of October. Programme for Government commitment in September committed to end food banks as the primary source response to food insecurity. We've published the consultation and it's going to run until the 25th of January. So far, we've had a really good response. There's been a mix of comments and a mix of people responding to the consultation between individuals and organisations. We know that some organisations are going to be preparing joint responses. Again, if someone wants to take part in a joint response, that's absolutely fine. We're keen for everyone who's affected to respond to the consultation. Again, and that's going to provide the framework for the cash first.
Diane, sorry, can you put your microphone closer? People are struggling to hear.
All right. Sorry, wait till that update. Right. Is that a wee bit better?
It's just the microphone a little bit near where you're talking.
All right. Sorry.
I think you're okay, Diane. Just speak a little bit louder because there's just a few people that haven't been able to hear, but mostly you're doing, yeah, it's all fine.
I'll shout.
Great.
Okay, so for this slide, for the wider considerations, this is just for people to have a think how we can move this forward. So what do people think about access and support for Cash First? We have linked closely to people with direct experience. We're keen to find out from people who directly are challenged by food insecurity. From our workshops, they have stated that communication is key. They would like to be involved in workshops, and we're keen for that as well. Obviously, we want to make sure that people that may not normally participate in consultations have the opportunity to put their views forward as well. Everyone's view is so important, and we need to know what the challenges are so that we can work together with partners to put appropriate responses in place. Best places to locate crisis support. Is it a food bank or a community organisation? Is there anything else that the local authorities organisations can put in place? What will it mean for local service delivery? Resources, are there sufficient resources in place? Would additional resources need to be put in place? How do we promote it to groups of people, as I've said, with direct lived experience that may be reluctant to engage? For example, asylum seekers, people that have no resource to public funds, gypsy travellers. There's a whole range of groups out there that we're really keen to engage with. So I would like to encourage everyone, if they can support people and let people be aware that the consultation is there, and we are so keen to hear from people. It's so important so that we can get the right support in place and take the commitment further. Thank you.
Thanks so much, Diane, for that. It's really wonderful to have you here, to be taking part in this event, to hearing what people have to say today. And we really welcome your invitation for as many people as possible to take part in that consultation. So thanks very much for that. I'm just very quickly going to give a little bit of context about why it is that we've decided to host this event series. Starting off with the purpose of today's discussion, which is really to look at reorienting the focus of the work that we're doing to support people who are facing food insecurity towards the financial grants and entitlements that exist currently for people at local authority and national level. We've been working in partnership with people right across Scotland for a number of years on shifting this focus, and it's becoming more important than ever to see as many people as we have here today taking part in the discussions, trying to understand what role they can play in moving in this direction. So as I say, we've been working alongside partners to build resources, skills, and confidence in people in a range of different settings. And there are plenty more people out there that are doing the same. One of the examples you'll hear about today in particular is the Worrying About Money leaflets, which have been co-developed in partnership with a whole host of different frontline services and providers right across Scotland, and in partnership more recently with the independent Food Aid Network, who's been working in 44 local authority areas across the UK. There are 55 more in development. This is a tool that was developed as a pilot as part of the A Menu for Change project a number of years ago. So absolutely credit goes to people who were thinking about what we could do at a local level to reduce the barriers to existing support. And now we see people right across the whole of the UK interested in this simple to use, easy tool that helps people have these conversations. I'm going to pass over as quickly as possible to our panel because we've got plenty of really interesting speakers coming along to speak to us today. But before I do, I just wanted to emphasize the point that we have, just to give a little bit of an introduction to who we've got today. We've got Flora talking about her research on the role of health professionals, what low-income families really want to be able to have those need from those conversations, and how they think health professionals can support us through financial inclusion pathways. Hannah will be discussing some of the work that we've just seen published yesterday that we can pop into the chat about the way that these worrying about money leaflets have been used across Scotland currently. Sandra will be able to give us a little bit more detail about the way that they've been developing that work in Highland. Alison will give you more information about what it is exactly that these speakers are going to be speaking about. But after that, we'll be hearing from David, who's going to be speaking to us about the no wrong door approach. This is not something that we use specifically in the food insecurity world, but there are lots of lessons that we can draw from the range of different work that's been taking place in the homelessness sector. And so really delighted that we have him here to speak with us as well. And before we get started, I did just want to emphasize this point that having to worry about whether you can afford the food that you or your family need to be healthy and well is inherently in opposition to dignity and human rights. That is why we're here today within the context of the Dignity in Practice project. It is the government's responsibilities to realize the right to food, but every one of us has a role to play in helping people to access existing financial entitlements and grants to support people to afford the food that they need. So without terribly much more from my side at this stage, the first part of this series starts off today with embedding cash first approaches across the referral pathways. Next week, we'll be picking up on how examples of how people are improving the response that somebody gets once they get to the financial advice and support. So lots and lots of activity in this space, and we're really delighted to be highlighting and supporting people who are working in this field and raising these examples. Alison Goodfellow is a member of our Dignity Advisory team. She's also the project manager of the Maxwell Centre in Dundee, and we are absolutely delighted that she'll be moderating this panel. So over to you, Alison.
Thank you, Chelsea. I'm delighted to have the privilege of introducing our panel members for this morning's discussion. Firstly, I would like to introduce Hannah Biggs. Hannah is a senior researcher at ScotSend Social Research. ScotSend was commissioned by the Independent Food Aid Network to conduct research in 4 local authority areas around the development of the use of worrying about money, cash first leaflets. IFAN have now co-developed leaflets in 19 local authority areas in Scotland, with 4 more in development. This research sought to understand how the worrying about money leaflet was being used in different local authority areas in Scotland, and to capture any emergent impact. And as Chelsea's mentioned, it's perfect timing. The research was published yesterday. Also joining the panel, we have Floria Douglas, whose role is reader in nursing at Robert Gordon University in Aberdeen. Flora has been involved with a range of local and national steering groups concerned with addressing food insecurity. She has a particular focus on the experience and impacts of household food insecurity on the management of long-term health conditions. In 2020, she conducted research with low-income parents in the northeast of Scotland about their views of the challenges and usefulness of speaking to health professionals about financial problems. The study was part of a wider exploration of the role of health professionals in promoting cash first approaches through a financial inclusion pathway. Sandra McAllister, a health improvement specialist at NHS Highland, also joins us today. Sandra was part of the working group who co-developed the Worrying About Money leaflet for NHS Highland in 2020, alongside the Independent Food Aid Network, the Trussell Trust, Highland Council Welfare Rights Team, Citizens Advice and Social Security Scotland. Sandra has developed a Money Counts training course to support the use of the leaflet in practice by helping staff and volunteers build their skills and confidence to ask about money worries in a range of settings. This course has been taken up by partnership in other parts of Scotland and the rest of the UK as part of a strategy for implementing CAS first approaches alongside the leaflet. In addition to the 3 levels to the Money Counts training course, there are development trainers sessions to support more people to take part. Before we start discussion, can I just say we don't have time today, unfortunately, to open up to questions from everyone, but would ask for anyone to use the chat facility to capture any questions you may have. So I would like to start the discussion by asking the panel, why is it important for staff and volunteers to have the confidence to speak to people about money worries? Sandra, do you want to start us off?
Okay, I wasn't expecting to come to first, but thank you for the introduction. It's important because they are the individuals who are dealing with people that are coming to them in crisis. Having a good conversation about money matters could be the difference between somebody accessing services or not. So making sure that staff recognise what part they can play in having that conversation is absolutely crucial in our view.
Thank you, Sandra. Hannah, do you want to tell us why it's important for staff and volunteers to have confidence to speak about people about money worries?
Yes, absolutely. First of all, I need to apologise. Some banging has just started happening in the building. So if it's disruptive, please let me know and I'll go back on mute. Well, yes, I just building on what Sandra said, what was coming out of the research that I've been involved in is that people said that without having the confidence to be able to, how the Worrying About Money leaflet has kind of helped them, is that a lot of people are worried about starting conversations about money, partly because if they don't know where to refer people for support, if they don't know what's available and how to direct people. And that's one thing that has really come out from the research is the Worrying About Money's role in helping staff and volunteers particularly know how to guide people to relevant support, and particularly knowing that because the support organisations were involved in developing the leaflet, they know that they're on board, that those services are going to be open to offer support for individuals. So yes, that is why it is so important that staff and volunteers have that confidence so they can direct people to the right support.
Thanks, Hannah. Yeah, it's just so important having the right information available. Floria, do you want to come in the discussion?
Yeah, happy to do that. Again, I think maybe I was expecting to talk about the study first, but that's fine. I'm happy to respond to the questions about parents. I think from the perspective of having talked to parents, having done research with parents of children under 5 who live in Aberdeen City, what came out strongly from those conversations was fears about raising the issue because it might raise flags about their capability as parents and raise questions about child protection issues. This was something that was deeply troubling and humbling to hear from their accounts. Parents were very clear that they felt health visitors in particular, we were asking them about the perspectives of talking to health visitors or midwives or family nurses about financial challenges and worries. And they did see, as I say, particularly health visitors and family nurses as people that they felt would be able to help them, would be able to signpost them to advice, but were not necessarily comfortable in doing so because of, as I say, these concerns around how they would be judged as parents and what the potential negative consequences of that could be. So there's a lot more to say about that, but I think I'll maybe add further remarks as we go on.
Thanks, Flora. Yeah, it's great to hear discussion around just how very important it is for all of us to have these conversations around money worries. And I would now like to ask what tools and resources help to have quality conversations. Hannah, what is it about the Worrying About Money leaflet that helps people have these conversations?
Well, what those that took part in the research, what they said really was that they found the Worrying About Money tool really helpful. They found it a really straightforward tool, and they particularly liked the pathways from identifying what the issues might be that individuals are facing in terms of financial challenges, and providing a pathway, a direct route to supports, and actually really highlighting what support services might be the most appropriate ones to contact for particular issues. So that was definitely that something came out of the research, that it was a very straightforward tool that didn't necessarily need a lot of explanation. A lot of people said that, you know, by looking at it, they said it was quite straightforward, self-explanatory. They knew how to use it and to be able to use it as part of a conversations. So that was a really important tool for them. Having all the information in one place was another thing that people said was really valuable, that, you know, there might be staff and volunteers that are aware of the support available and who to direct people to, but having it all in one place meant that they didn't have to constantly look up the contact details. And it was also a tool that they could either just use for themselves, have in their diary, have in their bag, but also maybe hand it out to people as well. So it had that kind of flexibility of being a tool that they could use themselves, but also to use with people to show them, a kind of visual tool as well. But as I'm sure Sandra might go on to say, that, you know, that's only part of it. Having the tools there is really important, and the information there, but in terms of having the conversations is sometimes more that needs to be said to that. Sandra, I don't know if you want to come in there.
Yeah, Sandra, what have you learned about running the Money Count training, and about what concerns people have, and what helps to build confidence around these conversations?
I think we're up against a culture where we don't talk about money, and going back to maybe what Flora said, there's a judgment if you are not coping because you don't have enough money. So what we do in the Money Counts course is we set it in the context of poverty, and then try and make sure that people understand what situations those coming across might be in. And using the leaflet to have a quality conversation, asking permission, offering up information, and doing that very much in a non-stigmatizing way, making sure that people are supported then. If the leaflet in itself is probably not going to change somebody's world, but by being supported to make the next steps around using the leaflet to access services that are there, people are more likely to have a positive outcome rather than just put the leaflet in a drawer and not use it going forward. So I think it's also important that people who are supporting individuals feel confident they know the services that they're referring to, so they have confidence in supporting somebody accessing them, know that the individual will be supported, will be treated well, that they will be potentially reach an outcome which is a positive for them.
I don't know if I can. Sorry, I was just going to respond to something that Sandra said that just made me think from the research there, that just to reiterate, that is what people were saying, that while there are really helpful uses, people did experience challenges sometimes in being able to access people, or have those kind of, you know, not being able to get a quick response to things. And that's just come up in the chat as well, someone saying that as an issue. So even if there are good tools and resources, it is about the kind of the communication with support organisations.
Yeah, sorry,
Flora, what challenges do parents foresee about speaking to health professionals about money worries, and what are the key ways to overcome this?
Well, I think building on what I was saying last time, just earlier, I'm thinking about both what Hannah and Sandra have been saying in relation to tools. From parents' perspective, we asked them, you know, what would help you to have those conversations with health professionals. A key theme was framing the notion of seeking your social security entitlement, seeking to maximise your household income by looking to see what you're entitled to and claiming those, should be presented in a positive parenting manner, that it would be that would help them and others deal with or confront notions which we get in the media all the time of fecklessness and people gaming the system. That it's actually not a negative thing to do, it's a positive thing to do, and that was a very, very strong theme that came through. So as a tool, actually having the conversations situated in that way. Another aspect was that they recognised there was probably more knowledge about the social security system amongst their peers and other parents like them, that they could gain, that they actually talked about how they actually learned about a benefit and how to get help with that benefit from knowledge within their own networks, and so sort of strengthening the role of community and community networks in helping, because they were also conscious of time. And then, although I haven't had a chance, but I'd hope to say something about the health professional, what we've learned from talking to health professionals about their experiences of doing this work as part of routine consultations. That they were aware of the time constraints that the health professionals had, and that was something, again, that had come from research with people with long-term health conditions and their perspectives about raising financial and food access issues, related food access issues, that they didn't perceive health professionals necessarily had the skills, knowledge, but also the time constraints they were fully aware of, and that was something that really inhibited conversations. And I don't know how we get around that, because that is a reality, and that's what health professionals are telling us, and that's what people themselves are saying is something that is a constraint in having the time to be able to talk through, because everybody's different in terms of their situation, their level of food insecurity or economic precarity, and that people are conscious that there actually isn't a great deal of time in those in those clinical encounters, so to speak. So I think those are the two. Sorry.
I was just going to say, it's interesting, just as you're saying that, Flora, there are comments coming up in the chat exactly about that, about maybe more of the onus needing to be put on health workers to kind of get that understanding, that awareness raising, so they're able to have those conversations in a constructive sort of way, which again really ties back to Sandra's work, the work that Sandra's doing with the training to try and embed that awareness.
And I can't see the chat, so can I quickly check in with Chelsea and Irina if there's any questions or threads that are coming through?
Yeah, that point that Hannah just raised was something that came up just recently, and I think Sandra could maybe share a little bit more about the training that you've been doing and who's been involved in the Money Counts course, what kinds of people are coming along to that, and what having those initial conversations about just even engaging in a discussion about money worries, how you're building skills and confidence in people around some of that. So maybe just a little bit more about what that's looked like in practice and who's coming along.
Yes, thanks, happy to do that, Chelsea. So one of the things we know is that handing a leaflet to somebody is probably not going to have a positive outcome. And therefore, we wanted to use the leaflet as a means to try and increase the quality of conversations that individuals had with people they were dealing with. So we developed a course that focuses around poverty and then goes through the leaflet, which is a very simplistic format, but an easy to format, as Hannah has indicated. The research has kind of highlighted as well. It's a 45-minute course. It's short because actually this is not rocket science. It's just about making sure that people know about the leaflet and have some examples of conversation openers that they could have to increase that confidence and knowledge around asking about money worries. We have run the course since March this year, and we can show that confidence and knowledge levels have increased for those who have attended the course. We've had people from statutory organisations like colleagues in NHS Highland Council, Social Security Scotland. There is an information sheet there. Where I'm happy to share whatever anybody needs. There's been a question flicked up in the chat there. Lots of third sector organisations, and then we did a post training feedback, and it appears that people are still confident and still have knowledge 4 months after they've come to the training. So that's really been a positive. What we have done is we've opened up the information on the training to IFAN, and they have used that when they're developing leaflets in other areas. And we have just agreed with them that we're going to do a national training for trainers network training for Scotland, so that if you're interested in learning more about the training, come to that. It's in January, and information will hopefully be posted on the IFAN website, and we can hopefully ask Nourish maybe to do that as well. I hope that's enough, Chelsea, but if there was anything specific you wanted me to say, please prompt me.
No, that's great. And there were a couple of questions that came in as people registered. Alison, I wonder if it would be okay to ask one of those?
Of course.
Yeah. So it was just in relation to this point around, it relates again to this point around confidence and time to have the conversation. And I know Flora's already raised that there's a real challenge in the time to have the conversation. And Flora, well, anybody in the panel, I guess, but I wonder whether you want to speak a little bit more to the confidence, because that is one of the key, we can't solve everything, but one of the things that has kept people back in a range of settings, not just in health professional settings, but in lots of organizations, is not wanting to have the initial conversation because they're worried about not being able to answer the questions that come up after that. One of the things, of course, we know from the leaflet is that it gives people that confidence because they know that trusted agencies are on the leaflet. So they're, they know that they're sending them to the right place. But Flora or Hannah, I wonder if there's more you wanted to add about that sort of confidence to have the conversation.
Yeah, sure. I mean, and this taps in very much to the research that we are finalising that has been looking at this implementation of the financial inclusion pathway, which is part of the local child poverty action plans, all local child poverty action plans in Scotland, which requires early years nursing the services to raise the issue of financial challenge in routine conversations with either pregnant women or children, families with children under 5, parents with families with children under 5. And the issue is, and this, we got funding to do NHS endowment funding to talk to health professionals about their experiences of this at an early stage. So we conducted the research in the summer of this year with 17 health visitors, midwives and family nurse practitioners across the Northeast, as well as 12 further parents on top of the 10 parents we spoke to in depth last year about the experiences of both raising the issue and as a health professional, but also in raising the issue as a parent. From the health professionals analysis, the confidence thing is definitely an aspect. It's important to at the same time highlight that there are these 3 different health professional roles have different capacities. They are engaging with parents at different points in the journey. So community midwives will be working with parents in the early stages of pregnancy through to up to 28 days after delivery. Health visitors would typically take over from that point and work with parents up until the child is age 5. Family nurse practitioners are a fairly new health professional group discipline that's been developed based on, I believe, an American model that's UK-wide, as far as I understand, and is designed to support young parents with children young parents 19 and under, offering them a family partnership with model of support up until the child is aged 2. And those family nurse practitioners start very much on the basis of economic issues being a fundamental part of their practice, and that issue is raised right from the get-go and is understood by both the client and the nurse that they will, the family nurse, that they will work on that and support them on that issue. So there's very the family nurses that we interviewed were very confident about this and on very sure ground, and had very deep knowledge about those issues, and there was no barrier. They were an open book, that's one of the quotes, because that's set right from the get-go. Health visitors and community midwives are in a different position. They certainly midwives of the two of those groups were less confident and were less likely to raise it as an issue in practice, not because they didn't think it was important, but they just didn't have time and didn't have confidence and believed it was someone else's role really to take it on. Which is interesting because they and the other health professionals and parents themselves say that it's in the late stages of pregnancy and very early parenthood that financial challenges are greatest, and where income maximisation work could have the greatest impact. But they seem to that this is a challenge for them. So they express least confidence and least knowledge and frustration about not having knowledge of what they could offer and how effective it would be. Health visitors were less reticent, and they were very clear that it was an important aspect of their practice. But again, there was a reticence, and this was due in part to it not being raised. There were some very clear cues, so for example, the midwives did talk about if a parent was in the social security system, if the client was proactive in asking about benefit entitlements forms to fill in, that was a cue to talking about financial issues, that they were in comfortable ground, comfortable territory, and that was fine. It was those who didn't raise the issue, or it wasn't apparent from their appearance that there was a problem in a decontextualised clinical setting, a healthcare centre or a hospital. And it was only once you were in a home environment, if there was a home visit took place, that it was more obvious that there was a reason to ask if there was a problem. So the information that people are using to make decisions about asking, I think, was an important aspect of the sort of environmental cues that enable them to have those conversations. I think one final point, and I'll shut up after this one to let others speak, was that it's the point of our interviews in the summer and late spring, early summer. So again, a key theme or a common theme was the participants talking about health visitor participants in particular, saying that they were having more conversations about poverty and economic precariety than they had previously had or ever had, and that it was actually something that was more they were having in their team meetings more discussions about than they've ever had, which is interesting because the health visitor pathway, and they made comment on this themselves, the health visitor pathway, of which there is a health visitor pathway, has a requirement for this issue of raising financial issues. So I think there are secular trends that we should be aware of in relation to the confidence to talk about it. It's becoming more sort of socially acceptable, and in a sense, sadly, but that was also part of the, I think that was an interesting thing to kind of flag in this conversation. So I will shut up.
Thanks, Flora. I don't know how much time we've actually got left.
I think we have
Hannah,
about 2 or 3 more minutes.
Okay, Hannah, do you want to come in with anything that the research flagged up about?
It was just kind of as Flora was speaking there, it kind of just made me think about stuff, not just as part of this research, but wider work that I've done with individuals that have been facing financial challenges. And I mean, the confidence to talk about money or the need for support, it's on both sides. It's as Flora's kind of alluded to, it is on the side of families maybe not wanting to bring it up or to say that they need support, and then sometimes on professionals or volunteers. And I think what's really important to flag with the research is that the Worrying About Money leaflet is being used in a range of different ways across Scotland and I guess the UK as well. So, and a range of different organisations. So for some people that are using it, it is maybe part of their job to talk about this and have these conversations and have received training in that. And others, they may not have ever had these conversations before. So people are coming at it from different perspectives and different backgrounds, sort of thing. And in a range of different work I've done, whether it's kind of talking to people about sensitive issues, whether it is money, whether it is mental health or whatever, is often that fear of talking about something or bringing a conversation up if you're not an expert or you don't see yourself as an expert. And I think one thing that the Worrying About Money leaflet really does, it's not about necessarily you having the answers. It's about having the conversation and letting people know that there are a range of different support out there that people can access. And I guess as Sandra has spoken about as well, about those quality conversations, the importance of the training is about having those conversations in a sensitive way. And again, as Flora said, it's about normalizing these conversations, is that for lots of reasons, people might go through difficult times where they need a bit more support, and that's completely okay and completely normal. And, that there are a lot of things that people are entitled to out there. So I think that's just the point that I wanted to make.
Thank you, Hannah. I think that's all we've got time for, unfortunately, but that's been a really informative discussion around the practicalities and the importance of being able to have these quality conversations. I'd like to take this opportunity to thank Hannah, Sandra and Flora very much for taking part in the discussion this morning. And I will pass back to Irina, who will introduce the questions for the small group discussions. Thank you.
Thank you, Alison, and thank you, everyone. So now we are going to have an opportunity to go into small groups and be able to discuss what we have just heard and learned. And one of the questions is, what was interesting for you from the discussion this morning, and what did you learn? So Diana.
Hopefully that was a good amount of time to reflect on some of the things that we've heard from the panel discussion. And it was nice that we decided to do small groups so everybody could have a bit of a chance to speak. And I wondered whether, well, what we're going to ask you to do is just take a moment and either put in the chat, or Deanna will pop up the Menti in a second here, an example or a point or an action or just something that came up for you that you're taking away from the discussion today. I'm sure everybody has at least one thing that comes up for them. Can see some things coming up on the Menti, or is everybody feeling comfortable around using the Menti again? The code is up at the top there if you need. Something coming through the chat as well. It's important to note the difference in different environments and the roles, different roles that people can play in different spaces. Lots around partnership working and everybody taking a role. And enthusiasm around the IFAN leaflet, which is great. That leaflets and training are available, so that there is support available for people in these frontline settings. So it's about making use of what exists. It's really wonderful to hear from Sandra about the partnership around Train the Trainers, and that training course will be sort of rolled out more widely. Differences between urban and rural settings. Just a sense that we're not working alone in this, that lots of partners are involved. I really like that. There was a sense from our discussion about the shift towards being able to have these conversations more than probably prior to the pandemic. And again, something around collaboration. We've got a couple of, there's a point around, you know, what happens when we refer somebody, but it takes quite a long time for them to access the service. Next week, we'll be talking about improving the cash offer. So of course, if we're encouraging everybody to move towards financial grants and entitlements, we want those referrals to be positive referrals. We want people to feel confident about sending someone to an agency. And there certainly will be a lot more that we can talk about next weekend for many months in the future about making sure that people are received on the other end of that well. And again, this point around building confidence in people being able to have the conversations. Brilliant. So much to gather here. That's really excellent. We do have, oh, I don't think you can't see my screen just at the moment, can you? So let me see if I can pop that back up. What's happened here? Can you see the screen now? Yeah, is that okay? Sorry. Excellent. So we're really delighted to be welcoming David Ramsey, who's going to be sharing a bit of information from the Homeless Network's work about using a no wrong door approach. We're absolutely delighted to be inviting him into the conversation because there's a whole host of learning and experience that he's going to be able to bring to us into the discussions that we're having around food insecurity. So David Ramsey is change lead at Homeless Network Scotland. Having grown up on the south side of Glasgow, David started working with the Homeless Network because of his concern that the system was trapping people in a cycle of unsettled temporary accommodation and a lack of control over their lives. He has spent years working to promote more supportive approaches to prevent people from becoming homeless. So, David, all right, yeah, there we go. And I will move your slides along if you just let me know when and how.
Thank you. I know I'm having a bit of a techie nightmare today. Just go to the third slide. So I was introduced there. So as an organisation, there's a couple of projects that we're involved in, and we're looking at a no wrong door approach. So it's a lot of the stuff that I've heard earlier on about when to ask, etc. So I'm going to just, it's a short presentation, guys. So it's a wee whistle stop tour of some of the things that we're doing. So if you just flick on to the next slide, please. So we got involved in this. We're working with Scottish Government, fund this, but they've put together, it's 30 organisations, it's people for frontline staff predominantly, some council members, and All In for Change's lived experience element of it. I think there's more than half it's people with lived experience. So that works in conjunction with the Scottish Government to look at preventing homelessness. As we've got great legislation on homelessness, brilliant, but we found that we're actually behind countries like Wales, etc. They're doing a lot of stuff preventing better than us. So that's when the Scottish Government put some money in to fund this, to ask people, right, what do we really need to do to make a difference? Okay, so next slide, please. There's like loads of messages, there's loads of different approaches, as I'm sure you're aware. So what the group decided was, to make it easy, they'd put it into these four areas: people first, at home, no wrong door, and good vibes. So I'm here to talk about no wrong door. So what no wrong door in practice means, that we're trying to prevent a new duty to prevent homelessness and clearer pathways for people most at risk. The people most at risk, as I'm sure this won't be a surprise to you, is predominantly people in poverty, people with mental health issues, people who've got childhood trauma. That's one of the biggest drivers of homelessness in later life, is childhood poverty. So we're trying to put clearer pathways for people in. Support joined up working in less silos and services that don't put people first. So that's trying to connect services that don't, whether by legal definition they can't, they've got legal duties they must carry out. But what we need to try and do is connect everybody in together, ensuring people basically don't need to keep telling their story again. Because that's one of the things that just re-traumatises people. You hear that getting said. I lived that life for a long time, so I know that's true. It's like you're sick of being sick. You know, you can't move on. It's like I was on benefits for a long time in my life through my addiction background. And you couldn't even think about moving forward because you had to keep kidding on you were sick. So it's like, keep telling this story about how you were 5 years ago. So that's what people tell us. What the no wrong door approach will do is identify households that are at risk before they reach crisis point. So this is something that nobody will disagree with this. No, everybody will agree with this. But how do we get this in practice? So next slide, please. So how we say we'll get that in practice is we have created a place-based approach, and it's targeting a whole community, and it's looking at issues around housing, social isolation, fragmented services, limiting economic opportunities. Basically what we are saying and others, and the Scottish Government are now backing this, and they've put in their prevention strategy, this is one of the models they're looking at, and it's this place-based approach. It's not a surprise to a lot of people that work in this anyway, that the community has the answers, guys. You know what I mean? We don't need to go elsewhere. In communities, there's so many things happening. There's so many resources. It's just that, unfortunately, we're not joining up. People are not feeling they can access them for a lot of different reasons. It could be stigma, etc. But the answer's in the community, and that's something that we're doing a few projects on this. We got money for the big lottery to test this out in a few areas of Glasgow, and one in the Gorbals, if you know Glasgow, and one in Pollock. And it's testing this approach in homelessness. And how we're going to do that is, next slide, please. And it's an ask, and I heard some of the speakers earlier talking about this. So what's got legislation is in the minute going through. It might not get passed, but that's immaterial. This is what we're asking, and it looks quite favourable that it might happen. As public bodies have got a duty to ask about a housing issue, not just that, act on it. It's not good enough just to ask. I heard it was other people were saying earlier about how do you ask about money worries, and I like that, but it's not good enough just to ask. We need to act on it, and that's where the no wrong door is. So it basically means it doesn't matter where somebody comes to. If they're coming for any sort of support, you don't turn them away. You make sure you act on that. So you either signpost them, you either contact the individual. So, because when somebody turns up at a health service, social work, whatever it is in a community, that might be the first and only time they'll ask for help. So you can't turn them away. You can't be turning in and saying, oh, sorry, that's not a service we provide. That's not good enough. So we need to be doing this ask and act. One of the other things that we're looking to do is move it up to, you can put a homeless application in 6 months before. It's only 2 months now, but that's not long enough. That's why you're seeing people having to present homeless on the day. So that's what we're looking for that. But in the no wrong door, I'll just stick to the ask and act. Next slide, please. A simple two-step approach. Basically, I heard somebody saying it earlier, these are no rocket science. This is no anything we don't know. We've just created such a big, and I'm only talking about homelessness here, we've created such a big, strong monster that all these things that you need to get through, when ultimately we don't need that. It's a simple things we need. Get back to basics, guys. So basically just ask people and act on it. And that understandably can be difficult for people. So next slide, please. I know I'm rattling through this. I know I've only got 7 minutes, so when do you ask about housing security? There you go. It's about money worries is there as well. So you need to be in the right position, I suppose, and make sure when you're acting on it, guys, is that you're introducing people and you know the services you're sending them to. That's one of our sort of concerns is if this goes through, we need to make sure community people that work in communities are not just acting on it, and then what happens is they just refer everybody to it could be the wrong service, but we don't want people to actually be saying, well, we acted on it, we referred people, we done what the legislation says. So we need to make sure we get this right, so that when people are acting on it, that they're sending people to the service that they need. Thank you. And basically this is all we are saying when we're asked. You could take this into the money situation I already thought about, is just make sure it's the right environment. Make sure you've got the good relationship with people. It takes a bit of time. You need to build up trust. You can't just be flying in there with these questions, because people will just, I could tell you how I would feel if I just met somebody and they were asking me all these things. So take a bit of time, build relationships. As I say, link the person in where they need the help. Don't you decide, ask them. It should always be the person that's leading where they're going, no any member of staff. Make sure you're willing to spend time with the person accessing the right service, and then you're confident that you know the right services are there and how to access them. And I hear, which we have people for health, etc., saying, oh, about time constraints and that. And what we need to do is, which we're trying to do now, and it's gone well, is we're in communities talking to people in health professionals and actually saying to people, listen, see if you spend that wee bit of time with somebody, you'll get it back at the other end. But we need to begin people the confidence to spend time with individuals, because if you put it in at the beginning, it's prevention. If we put it in at the beginning, we'll get it back. So we just need to give people confidence to do that. And basically, that's my spiel. Over 7 minutes. Did I nail it in time? I didn't even time myself there. So thank you for inviting me. I know I can take a breather.
That's amazing, David. So much learning, rich learning in every single word that you have shared with us, and definitely there are lessons for us to learn in our own context. So thanks again. And now we're going to move on to the opportunity to discuss among small groups again about what we've learned from your presentation and what we can do in our own communities and set of work, and also in the work in terms of addressing food insecurity. So.
Same question, something that you're taking away from the discussion, something that struck you about either what David was saying or something that came out of your small group discussions afterwards. I think Deanna has a Minty for us as well, but again, just pop it in the chat if necessary, or if you prefer to do it that way. For me, it was about working really closely with individuals and building that relationship to be able to support people in the way that they need and they want, which I thought David spoke to really well, and also is something we really strive for in the food insecurity discussions as well. Caroline's just mentioned something she learned in her discussion around, the obligations around homelessness, and that there's quite stringent law around that, which isn't necessarily the case in the food insecurity world. And certainly a lot of people are left in a food insecure situation and after having spoken to service. Being more confident to build relationships with people and explore ways to help. Anybody else have anything? Oh yeah, sorry. So just reminding us again how to get access to the Minty. Importance of the environment to have these conversations in. That's a great, really important point, isn't it? Ask and act. Building trust. Reinforcing the need to take action. So we've talked about some of the challenges for people in terms of time and skills and resource, but also just a reminder of why we're all here, trying to make sure that people are receiving the support that they need. Jared's asking, will these be shared? Yes. So I will, as we close, talk about next steps. absolutely will be sharing the materials from today's discussion on our website. There already are materials on our website from the speakers about previous work that they've done or reports they've published. The importance of training to get skills, excellent. So that's brilliant. Thank you. I'm really glad that the discussions have been going so well. I hope you've been feeling that they have been going well. So it's just, we're really close to the end of our time here together. So I'm just going to do a little final wrap up. And just to say thank you to everybody who's taken part and everybody who's been, shared your time with us today, either as participants or as speakers. We have, this is the first of the learning series, the learning event series. The next event is the same time, same place, next week, next Thursday. And we'll be exploring what happens in the next step of the journey. So today was about thinking about improving the referral pathway, making sure that we were reducing the barriers to existing financial grants and entitlements. But what happens on the other side of that? What about when people receive that initial support? How are local authorities and other organizations working together to improve the support that people actually get when they are referred in that direction? Some really good examples of improving that cash offer for people. So if you haven't already signed up for that event, please do. I think there's some more spaces available. Also, just again, to point you towards the website where we've already been hosting materials from the speakers. We will continue to populate that website throughout the whole of the learning event series. So we'll have examples that have come up from today, slides from today, and some of the things that people have responded in the chat. So thank you so much for all of your contribution. Oh, sorry, did you want to, Irina's just asking me if we can see the Menti feedback again. And then just also want to flag that we've got, and that it's, Diane mentioned this at the start, and that there's an open consultation at the moment on ending the need for food banks, a draft national plan that the Scottish Government have produced, that they are looking for your feedback and your thoughts and your views on. It's open at the moment, and we can send you the link in the chat if necessary. And next week we will also be we'll be spending a bit of time looking at some of those. So if you have any further questions, please feel free to get in touch with us. We are really pleased to have had the support from Alison, Flora, Sandra, Hannah, David, and Diane here today. Thank you so very much, and to all the speakers and to you for your contributions.